Primary care is excellently placed to do cancer care reviews. Patients value their GP and they see that the continuity of the treatment, of the therapy, of the conversations in secondary care is incredibly useful.
The clinicians know their patients and their patient groups and demographics really well. These patients often have got a multitude of other conditions and other long-term conditions, and they're being seen in primary care anyway for the review of those conditions. And what we need to do is incorporate the cancer-specific bits of the review to that holistic review. Quite often practice nurses and GPs both are very well placed to do those well.
And now that we're seeing pharmacists based in primary care, this could be something that they could take into their remit as well. Think about offering patients a questionnaire so that they can think about the structure of the cancer care review.
It just gives them a chance to think and realise, actually, I could talk to my GP or my practice nurse about that. You need to think about whether there's anything bespoke to that patient that's important. So, for instance, somebody with learning disabilities, pictorial checklists might be more appropriate for that patient, and equally just being mindful actually of literacy in the area and the complexity of those letters you write. What's really important is giving patients an opportunity to bring someone with them, be it their carer or their next of kin. Do they need an advocate with them?
Practices can also think about their appointment structures. The standard 10-minute model might not be applicable for something like this, and there may need to be some flexibility in the system.
Sometimes a patient might have an extended appointment or a double appointment. Often we do cancer care reviews as face-to-face appointments, but alternatively, if you know a patient really well, then actually conducting a cancer care review over telephone is an option sometimes.
I also did the questions.
What you cover within a CCR depends on what the patient identifies either in their pre-questionnaire or within the consultation itself. So there were a few things that you had to discuss on this list. So you put hot flushes, weight, fatigue, ability to have a family. So kind of really big things here, aren't they? Did you have top key things that you wanted to address?
I think the main issue I have is around fatigue. I just haven't felt like myself.
Common items that are usually covered are medication reviews, pain and insomnia.
Symptoms from that particular cancer that they've got, or consequences and symptoms that have come about because of the treatments.
We talked a little bit about the weight gain and how that's bothering you. So we've got the Macmillan website, and what it does is it shows you about particular diets.
You might want to consider checking in on anxiety, depression screening questionnaires, or just touching base about emotionally how they're feeling. And then moving on to things like their needs around their social setting, particularly if there's any social deprivation issues, housing, benefits, employment issues. It's an amazing opportunity also locally to look at what services are available, whether you might want to refer to a social prescriber or somebody like that in terms of getting that patient support to navigate what's actually quite a complex system of support.
So there are great tools to enable the clinician to support data capturing and even structure to their cancer care reviews. There are national templates, like a Macmillan template, and we as an alliance have got our own one. And what they do is they enable data capturing in a seamless manner in front of the patient, which means that at the end of your consultation, you have a comprehensive record of your discussion. You can summarise back to your patient and indeed share. So Sarah, we're seeing each other in 3 months to review the pill, and hopefully anything else you want to bring up from today's, we could just address it in that session as well.
I had a cancer care review with my GP. I was a bit hesitant to actually attend because I didn't know what it actually entailed, but I am 100% glad that I did. We discussed the change of diet, medication, the numbness, and referrals been made for me to actually attend physio. She's pointed me in the right direction to support networks. Without my GP, I don't think I'd have been able to reach the stage that I'm at. It's like a safety net really, because what I can express to my GP, I'm not able to actually express to the consultant.
Having that cancer care review is actually giving a healthcare professional permission to have certain discussions with the patient.
A cancer care review, I think, is vital. Me sitting down my GP, someone that knows me, then being able to say, how do you feel psychologically? How do you feel physically? You know, what can we do to help there? To kind of listen to the person actually now, because there's a difference between the person and the patient, I think, and I think that for me is really important.